Hello everyone. Today we'll be talking about how to become a good vestibulogist. One of the main goals of the ongoing vestibular medicine educational program is to achieve excellency in the vestibular practice. So, being a good vestibulogist is the main goal of this program. So, what is needed to become a good vestibulogist, regardless from your background? You need to have the knowledge, you need to have skills, you need to get some mentorship, you need to have a specific attitude, and you need to have professional network. So these are the important things that you need to become a good and successful vestibulogist. So knowledge. Regarding the knowledge, you need to understand the anatomy and physiology of the vestibular system, and this is mandatory, and this is very crucial and very important. You need to know that the vestibular system is part of the balance control system, and the balance control system is composed of input, especially sensory input, then processing centers, then output. And all these are put in ongoing context, which is reactive to the environment and to the different tasks which could be done. You have to think beyond the ear, and you have to be aware of different pathologies and different causes of dizziness. Eye signs are the most important. Partial or complete loss of function, abnormal excitation, mismatch or sensory conflict, and oversensitivity of the vestibular system are possible mechanisms of clinical symptoms. Vestibular end organs, the eighth cranial nerve, brainstem, cerebellum, thalamus, cortex, are possible sites of lesions that can be clinically symptomatizing. Ear, brain, cardiovascular system, nervous system, psychic, blood, and metabolic functions can be the source of symptoms. Inflammatory, vascular, autoimmune, congenital, metabolic, toxicity, traumatic, degenerative, aging, and multifactorial are possible etiologies of symptoms. Skills. History-taking skills is very important. Extraocular muscle examination, identifying eye misalignment and conjugacy, identifying pathological nystagmus and its interpretation, able to do ocular motor examination, able to do clinical and instrumental head impulse test, able to do gait examination and to do modified clinical test of sensory interaction of balance. Eye examination, including otoscopic examination and special test. BBV diagnosis and management is mandatory because BBV is the most common cause of vertigo in all the dizziness clinics all over the world. But you must be aware that 40% are not posterior canal BBV, so it's important to be aware of the other variants of BBV. You should be able to differentiate peripheral from central conditions, and you should be able to differentiate benign from life-threatening condition. For example, vestibular migraine is a central condition, but it's a benign condition, completely different than posterior circulation stroke. You have to be able to differentiate otological, central, cardiovascular, metabolic, psychogenic, and combined causes of symptoms. It's important to be able to do counseling of your patients, especially informative counseling. You should be able to do a proper vestibular test interpretation, and you should be able to know what's the required investigations and how to integrate their results into the final diagnosis. If you are a physician, you should be able to know the different medical treatments for dizziness and the vestibular balance rehabilitation therapy. You have to be aware and to have some skills in providing some sort of vestibular rehabilitation therapy. Depends on your professional background. Surgical management, this is especially for the neurotologist and otolaryngologist. And it's important to be to know when surgery is indicated to treat vertigo and dizziness. Appropriate referral, that's another important skill because many different professions practice in the field of vestibular medicine, and there is a scope of practice for each profession, and there is some overlap, but also there is a specific or a unique services for different people working with the disease patients. So it's important to know when to do appropriate referral. And sometimes you need also other medical specialties to help you, like internal medicine to control hypertension or diabetes, like cardiac specialist or cardiac consultations when you suspect like orthostatic dizziness or cardiogenic dizziness. So it's important to know when and for whom you refer your patient. Mentor, and because mentorship is important, really, we created a virtual WhatsApp-based mentorship during the program. So if you didn't join, please join that WhatsApp group. It's very active group, and a lot of case discussions, a lot of clinical tips have been posted there, and I think it works very fine. It's also possible to discuss your case scenarios with senior professionals. That's important in the real life, and also it's available during the program. So feel free to send us your case scenarios on the WhatsApp group or email. If you want to present your case scenarios for discussion with more senior professionals, that's also fine. Share test results for expert opinion. If you have a trace, video recording, or any kind of test results you want to share for a second opinion, that will be fine also, and we'll do with pleasure. Attitude. Patient interest should be the priority. So patient interest should be the priority. That's important. If you keep in your heart and in your mind that the patient interest is the priority, that really will make you a very good vestibulogist. Vestibular practice is serious, yes. Some people, they tend to oversimplify things, but it's not that. It's a serious practice. And you need to listen to the patient. That's also important. Examine every patient carefully and make it a habit. Please do targeted eye examination for every patient or for each patient. That's important, so you know what is normal and what's not abnormal. And sometimes that's make you able to detect the subtle eye signs which are pathognomonic for some conditions. Use right terminology, use models, use diagrams during the counseling. We find it very helpful. That make it more easily understood for the patient and their families. Vestibular tests give information, but not a diagnosis. This is very important. The vestibular test give information, but not a diagnosis. You have to make the diagnosis yourself. The diagnosis of vestibular disorders is a clinician's task, not for the equipment or for the instrument. Artifacts are common, so don't overtrust automatic interpretation of the test, especially in the video steganography and the video head impulse test. So artifacts is common, so don't overtrust automatic interpretation of the test. Avoid rituals, like doing some procedures as a routine for every patient like this. You have to know what you are looking for. You have to know what you are looking for. Network. We all know that dizziness is ideally to be a multidisciplinary care. Many medical professionals and healthcare professionals are involved: otolaryngologists, neurologists, audiovestibular medicine physicians, audiologists, and physical therapists, and in some instances, occupational therapists, psychologists. So it's really it's a multidisciplinary care in the ideal conditions. Maybe you need some professional connections with neuroradiologist, or professional association with a neuroradiologist, with a cardiologist, with a psychiatrist, with internist, and pediatric neurologist if you see dizzy children or children with vestibular disorders. So networking, professional networking is important. The concept of multidisciplinary care is important. So if you have a team, that's good. If you don't have the team, you need to establish this kind of multidisciplinary care teamwork, and to have communication, a good communication channel with the other specialties who might get referrals from you. This kind of interactive communication is really very helpful, and it is for the sake of the patient interest. Equipment. You can practice even you don't have any kind of equipments. You can create your own. There is simple tools which really could help, and still you can help patients even you don't have much equipment. If you have a friend that Googles or a video Googles, that's also good, and still you can help a good percentage of patients. If you have one or a few equipments, still also you can also help a larger percentage of patients. And you can practice in a well-equipped center with all the equipment which is fully equipped, and that's also good. So it depends on your settings, that there is a chance really to help your patients. So in this program, we'll provide you with insight, with lectures, giving you skills about to handle your patient with minimal equipment, and at the same time also, if you have a well-equipped center, also you will have some lectures, and you will have good knowledge about how to integrate all these technologies into the practice. So whatever you have, there is an opportunity that you can help your patients, that you can provide service, very beneficial service, and in all the settings you will find that program is very beneficial for you. Learning curve. It's important really to know that is training in vestibular medicine, or actually in any discipline. It's a learning curve. So we learn over time. We need some time to learn. We need some time to digest. We need some time to completely understand. So first rule, do no harm. It's very important to know the red flags. It's important to know the contraindication of vestibular testing or procedures. You have to be careful with fragile elderly patients. So first, please don't do any harm. This is the golden rule in medical practice. Be gentle with the patient, especially in manipulating, especially in doing the positional testing or head impulse testing. You have to be gentle and put the patient safety as a priority. You need time to master skills. Don't get frustrated. Don't get frustrated. This is normal. Everything is a learning curve, and this is normal. So it takes time, and it takes some practice to master skills. And the rule that is, good practice makes perfect. It's not only the practice, but the right, appropriate, and good practice makes perfect. Titles versus competencies. Regardless of your background, title, or positions, competent clinicians in vestibulology usually gain recognition because there is shortage of those vestibular professionals all over the world. So whenever you develop your clinical competencies in doing clinical exam for diagnostic or doing vestibular rehabilitation or repositioning. Everywhere or anywhere you are working, you will get recognition, because really worldwide there is shortage of competent, knowledgeable professionals in the vestibular field. Knowledge makes you able to adapt to new technology and the new techniques. Yes, that's true. If you have the good foundation of knowledge, you will be able to adapt to new techniques because you understand the principle and the concept. And be aware that is the real exam is when you attend a patient. This is the real exam. It's not in the final exams or paper exams or whatever. The real exam is when you attend a patient. Our educational programs provide you with knowledge, clear knowledge about the anatomy and physiology, or lectures are linked, intended repetition and overlaps that's intended to highlight and to stress on the important concepts and skills. It varies from very basic level up to very high and advanced level. So get as much as you can. Get as much as you can, depends on your current knowledge and skills. But definitely you will be much better after completing the program. To get the most benefit of our educational program, try to write notes, build concepts step by step, think about it, listen to a lecture, think about it, apply to what you see in the clinic, and bring your questions. That's very important. Please bring your questions. We encourage you to ask questions. Never to be ashamed to ask. Never to be ashamed to ask. Your questions will be highly respected and it means something, and we'll do our best to address them, to clarify them, simplify them, and make it very, very clear. Because it's important really that is at the end of this program that you have clear concepts and clear understanding of everything. And this comes by bringing your questions. Don't hide or keep or be shame or be shy to share your question. If you don't like to share in public, share it privately into my WhatsApp or into the email, and we will address it for you and for your colleagues, because this kind of discussions really which is make things clear, and it's very important. And you can share your question privately. If you are not comfortable to share in public, you can share them to Avisa Standard Gmail at gmail.com. Okay, thank you very much, and best wishes in your journey, vestibular learning journey with us.